What would be a simple way to approach the transition for a parent like Sam?
The simplest thing that's effective anyway is to counsel them about the possibility of change. So one of the things that is most upsetting to people, I believe, is to encounter things that they have not anticipated.
I think it's really important for families to talk to other families and caregivers who have already been down that road. They've had experience with behavior changes and seizure changes and the transitioning process. And I think that better prepares the parents for what to expect as the child gets older, especially in terms of behaviors which they may not be prepared for.
Dr. Roach, is there a right time to make the switch?
It's probably different from one individual to the next. I would second what Christina said, though. The earlier you can start thinking about this, the better. Over and over and over again, you'll see someone who they've gone through their lives. Their child is 18, 20 years of age, and then from their perception, suddenly all of their pediatric care providers start one by one saying, well, you need to go see an adult doctor. And it's like they've spent 2 decades carefully assembling this team, and then it just crumbles. And I think that if they could just start thinking about this ahead of time, even when the child is 13 or 14, just thinking about it at least gets them in the right mindset.
Dr. Roach, can you discuss a little bit of the practical side of the process?
Overarching, we really have 2 healthcare systems. We have one for children and one for adults. The pediatricians have different training programs, different backgrounds, different interests, different personalities. The pediatric facilities are set up specifically for children. You go in, there's cartoons on the walls, things like that. And they're supposed to transition then to an adult system where the adult doctors don't know about the pediatric diseases. They're not accustomed to having additional people in the room, practical issues like that. This transition works pretty well for normal individuals. If you're 10 years old, you go see the pediatrician. Somewhere between there and 25, you stop seeing the pediatrician, you start seeing the adult doctor.